Hello everybody, good evening. Welcome to Nurse Note channel. Today we will speak about blood transfusion. What is the policy and the procedure for blood transfusion? At first, we need to know who is this responsible for blood transfusion. This is the responsibility of registered nurse. Registered nurse only is the one responsible for blood transfusion. Okay, there is steps. We will call it pre-transfusion. Pre-transfusion. Before we start to transfuse, we must to confirm all of this. The first thing is we have written order, written doctor order. Our doctor, who's the one need to transfer blood to the patient, need to write his order. His order is specified. His order must be contain everything: the amount of blood, the dose of blood, how many ml he will give, everything. So he must specify with written order. Telephone order at this one isn't allowed. So your doctor, he can't speak in telephone or sit you on telephone, you transfer 1 unit blood to the patient. So this is not allowed. You must have written order. And this written order must specify the amount. 1 unit or 2 unit. If pediatric, he must specify by cc or ml. So he will write to you, you give to the patient 50 ml or 60 ml. So he must specify the amount by cc or ml in pediatric. The second thing, 2 nurses must confirm order. 2 registered nurse must confirm doctor order. The time he write, like for example, he write at 3 p.m. transfer blood for patient for transfer blood after cross matching. So you will confirm this order at 3:05. So 2 registered nurse or 1 registered nurse and the doctor who orders the transfusion of blood. So they must confirm the order of doctor. And patient identity. So you must confirm your patient. This is the right patient or no. You must how you will confirm this patient identity by 2 ways. The first thing is to ask the patient his full name, 4 names, okay, or the patient MRN or medical record number. This medical record number must be the same with the one in ID band, okay. So here 2 nurses confirm order and confirm the patient identity. The third thing is 8 rights of blood transfusion. You must know the rights of blood transfusion. First thing is right patient. We said right patient by full name and MRN. Okay. The second thing, right reason why doctor need to transfer this blood to the patient, or blood, plasma, or anything from the blood product. Okay. Third thing, right blood product, what he want to transfer to the patient. Okay, blood or plasma or any product. So you must confirm what is the type of blood product doctor want to transfer to the patient. Right time, what time he orders this blood, or you will give this blood to the patient. Okay, maybe sometimes there is doctor right before OR, before the patient go to OR, you transfer a blood, or during OR, or post OR, or post operative. So you must confirm the right time for the patient for blood transfusion. Second thing is the right dose. What is the amount of blood you will transfer? 1 unit, 2 unit, 60 ml, 50 ml, how many, the amount of blood you will transfer to the patient. Okay, right side, where you will transfer the patient, where is the site of the patient. Okay, the patient, what is the unit he is in. Okay, the first thing is right documentation. You must document everything happen during this process. Document everything. Okay, the right response, if the patient have any reaction or no, the patient have reaction from blood transfusion or no, you must write this response. Okay, consent, the patient must sign the consent, but at this status must be the relative also sign at the same consent. So because sometimes the patient is confused, so it's considered not good. So you must let the relative of the patient from the first degree, okay, sign also in the consent. Okay, so you must have written consent. Lab request for cross matching. You must send for cross matching to this patient. Must be 2 nurses who confirm the cross matching before you draw the sample for cross matching. 2 nurses. One for drawing, the another one will be witness. The one witness go to the patient and ask him the patient full name, the patient MRN, the patient nationality, the patient sex, the patient age, know everything about the patient. So he is the right patient or she is the right patient. So 1 to draw, 1 to be witness and ask the patient. Okay, after drawing this the blood, this is in red tube. You draw the cross matching in red tube. So after drawing and move tube, sorry, after drawing this one, you write the full name of the patient and full MRN over the tube, and the two nurses sign over the tube. Two nurses sign over the tube. Okay, you send this one to lab. The request you send to lab must be contain all the data of the patient, all the data of the patient, patient name, patient MRN, patient diagnosis, hemoglobin of the patient. Okay, if the patient have any reaction before, if the patient transfused any blood product before. So you write all the data in the request. Okay, after that the lab call you. He said, خلاص, the blood product is compatible, so you can transfuse the blood now. What you will start? The first thing, before you go to laboratory and receive, you check vital signs of the patient. Check vital signs of the patient before you go to lab. So you here check vital signs. If the patient is stable or no. Sometimes our patient may have fever. If the patient have fever, so we can transfuse the blood now. We listen the fever first, so it become normal, then we can transfer. So first we can check the vital signs. Second thing, bring blood. You go to lab to receive blood. In lab or in blood bank, when you go to receive blood, you must do double check. You, the registered nurse, the one who go to receive blood, and the technician of laboratory, the technician of laboratory or of blood bank, you must check for serial number of this packed RBCs, serial number first. Okay, then you check the patient full name, the patient MRN, blood group of the patient, RH of the patient. So you check everything over the blood product. Okay, if you check everything is good, خلاص, you receive the blood product now. Then you go to your medication room to prepare your blood. When you go, must be another double check with another registered nurse. The one who is witness in cross matching is the one who do double check with you again for the everything, serial number, patient full name, patient MRN, everything in the blood product. So you do double check again. Plus you found everything is good, so you will go to the patient, you and the one witness with you. First, before you start to transfer, you check vital signs again. Check vital signs before you start blood transfusion. Maybe the patient have any complication, maybe the patient have fever. So you check everything before you start again. Okay, if the patient is stable, so you start to transfer. Okay, we can put with blood product, we can put normal saline. We can put normal saline in another IV line. So we will put 3-way in the cannula. The cannula must be large, wide bore cannula. Okay, from 20, 16, 18, like this. So you must put wide bore cannula for the patient. You can put 3-way in the cannula. The blood in one line, and the another line there is saline patent. Okay, you must start blood transfusion slowly with rate 10 to 15 drop per minute over the first 30 minutes. Then if the patient have no allergy, no reaction, no anything, you can increase after that. Okay, here we can use blood warmer for blood. So we can't warm the blood by cotton or by anything. So if you bring blood from laboratory or from blood bank, you use blood warmer to warm this one. Blood warmer during ongoing to the patient. Okay, if pediatric, you must use infusion pump. If the patient is pediatric, you must use infusion pump. How we check vital signs during infusion? You must do close monitoring for the patient at the time of transfusion. The first 2 hours, check every 15 minutes. The first 2 hours, check every 15 minutes vital signs. After 2 hours, you check every 30 minutes. Until finish. Okay, your blood product must be consumed within 4 hours from the time you take from blood bank. Must consume in or during 4 hours. 4 hours, not exceed than 4 hours. Okay, from the time you take blood from blood bank. Okay, the second thing, don't mix the medicine. Don't give the patient any medicine during blood transfusion. Maybe the patient have reaction or have anything from the medicine you will give. Now you don't know this reaction or this allergy from the medicine you give or from blood. So don't mix. Don't give the patient anything during blood transfusion except saline. You can give saline plus the packed RBCs. Okay, what is the side effect? You must inform the patient about the side effect to let him know. You ask him, if anything from this happened to you, you must inform me or you must tell me what is the side effect. First thing is itching. Your patient feel itching in his body, so it is the first side effect. Okay, the patient have headache. or shortness of breath. He feel dyspnea. He can't breathe good. So Here, this is a side effect. The patient have chills or fever. His temperature increased. He have shivering. So the patient he have side effect. The patient is dizziness or drowsy. Your patient feel not good. Start to be confused. So this is a side effect of transfusion. The patient had redness or skin flushing. He has redness at the site of transfusion. So this is side effect. If you found any one of this, you must do the next step after any side effect. First thing is stop transfusion, stop blood, okay? Don't continue, stop blood transfusions. This is the first thing. The second thing is start saline, give normal saline to the patient and open this one, let it run, okay? Yeah, but the first one is stop transfusion. Second thing, give normal saline to the patient. Third thing, notify your doctor. May he will order medicine to give to the patient, okay? Third thing is notify doctor. After that, what about the remaining blood? What we will do by the remaining blood? We will discard? No, don't discard the remaining blood. Okay, the remaining the blood set, you will send all to the laboratory with reaction form. You send again to blood bank with reaction form. So remaining blood sent to lab or sent to blood bank with reaction form. Okay. After that, you draw 2 samples for the patient. You draw blood sample to the patient according to your policy or the policy in your hospital. But the most common is 2 sample red, 2 tube red. You will draw 2 tube red plus the first void, the first urine for the patient. You will send to laboratory with also reaction form. Okay. The last thing, document your reactions. Document what happened to the patient, what time happened to the patient, what you give to the patient, and write OVR. You must write OVR to save yourself. Okay. If anything from this not happen, if the patient consumes the blood, if blood finish, the patient good, nothing happened to the patient, what you will do after transfusion? Vital signs. You must check vital signs after 1 hour from finishing or from consuming the blood. For example, your blood finished or consumed at 5 p.m. So at 6 p.m. you will start to take vital signs after 1 hour from consuming your blood. The second thing, after 2 hours. Okay, so the first thing, if blood consumed at 5 p.m. after 6 p.m. so you will check your vital signs. At 7 p.m. you will check your vital signs again. This is the last one. If the patient is good, so you make your documentation. The patient is good, have no reaction, have no anything, and you must write the start time and the end time. What time you start blood, what time the blood end. Okay, all good, خلاص, documented. You document everything. Must be 2 sisters. The one witness with you before is the one sign with you. So must be 2 registered nurse sign for blood transfusion. Now we finish our lecture today. If you found this one is good, please don't forget to do subscribe and share.